All right. Today we were talking about health communication. It's the final section of the textbook that we are going to cover. Long story short, health communication is extremely important, especially when we are talking about getting patients to comply with recommendations. All right. So this is obviously very pertinent in the time of the coronavirus. We've seen a lot of mixed messages or confusing messages with regard to health communication. This is research that's been going on for a very long time, not only in the field of communication studies, but also in the field of medicine. All right, so if doctors figure out what's best for you, they need to get those recommendations to patients in a very clear way that's going to get patients to comply. So a lot of patients. We see this now with Corona. If we can all sort of metaphorically think of ourselves as patients right now to stay safe from coronavirus. People are giving us messages, but not everybody is complying with them. And so this is what health communication really gets to. What are ways in which health professionals can get communication out there that is going to get people to comply with the recommendations? So one of the three examples we're going to talk about is washing our hands. So this is research. It seems very basic and elementary, but this is actually research that is extremely important. Um, so washing your hands, safe sex practices, so wearing contraceptive, using contraceptives, wearing condoms. And then the third one right now is this idea of like wearing a mask and social distancing. So these are sort of like the washing the hands and the wearing condoms are pretty large health campaigns that have sort of gone on throughout the world because people know that if you wash your hands, it's going to drastically cut down on the transmission of diseases. When we think about, restaurants, we think about shaking hands with people during the holidays. You're touching, you're hugging, then you're taking food and you're putting it in your face. People get sick during the holidays that way, in close contact with individuals, and all pre-corona stuff. And then also cutting down on sexually transmitted diseases by wearing condoms. This is a lot of condom campaigns have gone on throughout the world to try to decrease the spread of venereal diseases. Specifically, we think about the most the scariest one, if you will, HIV and AIDS. So this is what health communication researchers study. They say, what messages can we get out to the public to make sure that they are complying most readily with the health experts? So a couple signs we can see up here as far as the research is concerned. Let's go to this one above my face for a second. So the wash your hands, it's a pretty elementary sign, and it just sort of walks people through the steps. These sorts of campaigns people have found aren't as effective, right? Because they don't tell people the sort of why is it that you need to wash your hands, all right? They sort of go through the process and everyone's sitting there and it's like, okay, well, I know how to wash my hands, but I don't necessarily know why. We have these new ones about, using paper towels to, open the door handles. So what we have found, not me, but health communication experts, they found that people wash their hands, but then they immediately touch the door handle, which can be, disgusting with regard to the people who came before you who didn't wash their hands. So what's the point of washing your hands if you're going to start touching things that are already contaminated? What they have found is what people have found in the health communication field as far as effective use of communication strategies to get people to wash their hands is when they talk about the reasons why you should do it, when they show you the negative consequences of not doing it. So with regard to washing your hands, signs that use terms like contamination or preventing disease, these are things that resonate with people and they sort of understand why it is important that they now need to wash their hands. All right. So anytime you sort of let people know, what are the consequences of not participating in this type of behavior, this sort of, unhealthy behavior, if you let people know the consequences, people are more likely to follow, health experts' instructions. So all of, these four signs are just, four of the, hundreds of types of washing your hands signs you see throughout, public restrooms, restaurants, all that kind of stuff, throughout the world. And people try to figure out, okay, what's the most effective sign we can put up to make sure that people wash their hands, because we know that, one way to cut down on a huge amount of diseases that are spread throughout, the human species is just to get people to wash their hands. All right. So this is one way of going about it. This is one thing that people study. All right. The other campaign I talked about is getting people to family planning, condom use, using some sort of contraception, right? So this is another thing that goes on. We need to educate people as to why they should, practice, safe sex. Um, so we have a couple campaigns here, right? So this one, this sort of lifesaver campaign, right? It's a roll of lifesavers, but you open it up and it's a bunch of condoms, right? So it's a billboard. We have this one, useacondom.com, talks about like, look, if you have sex, like what's going to happen? You're going to have a kid, right? And it sort of puts the consequences right in front of people with regard to, is this something that you're ready for or you're not ready for, right? Obviously, if you're ready to have a kid, it's like, don't wear a condom with your partner. That's how babies are made, right? However, by making sure that people understand the full-on consequences. Now, this might not be as effective, right? Because if you have a kid, it's not it's not the worst thing in the world, right? If you're not prepared for it. But things like, the spreading of diseases, right, which are far worse than having a kid, that might be a more effective tool for persuading people as to why they, should wear condoms and practicing safe sex. The extended parallel process model really looks at why do certain health campaigns succeed or fail. So again, it's all about clarity, like what specifically do you want people to do? And then the second part is, making sure that people understand the, negative consequences of not participating in healthy behaviors. So one we can think about now is with this, with the coronavirus that's going on right now. There are health communication experts that talk about the failures of sort of the early persuasive strategies that were going on by various governments throughout the world, as well as the WHO, the World Health Organization. So they were, saying things like, don't engage in non-essential behaviors and socially distance. These are, if you start thinking about it, like these are very vague concepts that aren't specific, right? So what does socially distance mean, right? Like how far away does it mean? Now it's sort of okay, 6 feet away from people. Thinking the question of like essential, like what's essential? Well, what's essential to me might be different than what's essential to you. So if they say don't stay home unless it's an essential thing, well, I might say, look, like I need to leave my house just for, because it's essential to my mental health not to be cooped up all day. Some people say, well, it's essential that I go to the grocery store. Well, how often do you need to go to the grocery store? Some people say it's essential to go, once a week because they are, they need to buy fresh produce. Other people only need to go once every 2 months because everything they buy is frozen, packaged, processed food. All right. So this vague language with regard to what does social distance actually mean? This was language that nobody was familiar with prior to March. And the idea of what is and is not essential was also a very vague concept. So it became very poor language when these experts and these health experts were trying to get people to mitigate, engage in behaviors that mitigated the disease. So what would have been more effective would be say something like, stay home, wear a mask, stay 6 feet away from people who aren't in your immediate household, right? Those are very specific. Now, they're starting to use that language now. The problem is that it's, 8, 9 months into this thing and the cat is already out of the bag. People have sort of found new ways to get around the virus because there's so much confusing messaging around the coronavirus and what is and isn't allowed. People have stopped listening to the experts, right? So if you remember back in March, some of the top health people in the United States and even around the world, right? WHO were saying things like, don't use masks, or, masks aren't really effective if you're not a health worker because you don't know how to use them properly. And so there was this confusing messaging early in March, April, and May. And now people, the health experts are more on message with regard to stay away from people who aren't in your immediate household, stay home as much as possible, wear a mask in public. These are, direct, clear messages. The problem is that these individuals who are now giving these messages lost a lot of credibility before because they were giving out, mixed messages, right? They were giving out unclear messages. And so this is what the extended parallel process model looks at. Why do certain health campaigns succeed or fail? If you're not on message from day one, if it's not clear and it's not defined, everybody's going to sort of take their own definition. So again, you look at the term, what does social distance mean? To me, it might mean stay away from everyone. For some people, it might be, stay 6 feet away from people. For other people, it might be, well, just have like a group of only, have a group of 10 or less, right? So if we go back to March and April, they were saying things like, they were saying social distance, but they were saying, stay away from groups of 10 or more people, right? Well, 10 or more people could be from 10 different households, right? And now we're at Thanksgiving time and they're saying don't have Thanksgiving with people who aren't in your immediate household, right? Which is a different message. So is it less than 10 people, or is it less than 10 people, but they can't be in the same household, or they're supposed to be in the same household? Like, how do we define what 10 people are or not, as far as like who's in different households? If I'm just in a group of 10 people now, can I go to a different household and be in a group of a different, different 10 people, right? So this was all very confusing messaging, and each individual, was trying to figure out what these definitions meant, and the experts weren't being very clear with what they want. Again, if they said things like, wear a mask, do not interact with people who are outside of your immediate household, and if you have to go to the grocery store, stay indoors, only go to the grocery store once a week, and stay 6 feet away from every other customer. Those are very clear things that everybody can understand. But when you use vague terms, people aren't really sure what that means, and then it becomes a problem. So that's the problem with health communication. Same thing is true with the washing your hands stuff, right? How do you wash your hands? How long do you wash your hands? Why do you need to wash your hands? And as well as condom use. All right, so there's 4 ways in which people individually sort of address whether or not they're going to take the expert's advice. We'll talk about this over here with men specifically in a second. But the first thing that people take into account when it comes to whether or not they're going to follow expert advice is susceptibility. So if an individual believes he or she could be at risk at experiencing a threat, they're going to take the health expert's advice. So if you're a person who has those comorbidities, so if you smoke, overweight, diabetes runs in your family, heart disease, if you have other underlying health issues, you feel like you are more susceptible to something like the coronavirus, so you're going to take that more seriously. We see with younger people who don't have underlying health issues, we have all seen the stuff online. Hopefully you haven't been to any. If you have, hopefully not that many. Big college parties, we see this sort of stuff where young people just don't feel like they're susceptible, so they're going to engage in more risky behavior. There are people who are older, my parents, for example, who have just been, in their house, they go to work. My sister, who lives near my parents back home, back in the Midwest, she brings their groceries to them still. We're, 7, 8, 9 months into this thing now. So that's when people are going to follow advice, if they feel like they're susceptible to these actual ailments. Perceived severity of the overall, right? So is the threat serious or not serious? Self-efficacy. So if you believe that you're in control, you're going to feel better about the outcomes. So, something with regard to this the immunity issue with the coronavirus, right? If you feel like I feel okay to go out and be a part of the world and to engage with individuals and not socially distance as much. If you feel like you're in control, if you're like, I got control of my diet, I'm going to the gym, I'm making sure my immune system is like healthy and ready to go to fight this thing, you are more likely to engage in risky behavior, or at least not feel threatened if risky behavior happens, right? So if you're out in public and like someone gets close to you, you're not going to, freak out about it if you feel like you've taken more control over your situation with regard to, again, like making sure you're not smoking and, if you are eating healthy and taking care of your immune system and exercising and working out, right? So self-efficacy. And then finally, response efficacy. So will the response actually help? So I'm willing to take the doctor's advice if I believe that the doctor's advice is actually going to help me. So if I believe that masks are effective, if I believe that social distancing is effective, if I believe that if I go to a restaurant, eating outside as opposed to eating inside is effective. If I believe that these things are actually going to help, then I'm going to listen to the doctor's advice. If I don't think that these things are going to help, I'm going to not listen to the doctor's advice. So real quick sort of thing on response efficacy here. Something that's interesting is, men go to the doctor less than women do. Um, and men who are married go to the doctor more often than not married men. And the short, version of all this research is because, married men go to the doctor because their wives make them. All right. Unmarried men don't go to the doctor that much. Now, there's a lot of interesting research as to why this may or may not be true with regard to men and women and going to the doctor. One of the reasons I think is probably accurate is because women from a young age, when they're girls, right, sort of get start to regularly go to the doctor when they're girls, right? So during the going through puberty, girls experience things that boys don't, that facilitate the need to be more in tune with their body. All right. So getting a period, right? Going to an OBGYN sort of early on. Girls get in the habit of going to the doctor regularly when boys don't. Boys might go to the doctor to get some sort of athletic waiver sign so they can play fall football when they're 15. But they go in, it's like a weight check, the doctor checks your heart and you go. It's not an invasive sort of like, let's really sort of see what's going on in your body kind of process. And so there's just not a habit being formed with boys the same way that habits are being formed with girls. And so I think that's probably a part of it with regard to why men and women might be just have different responses to whether or not they should go in for regular checkups or not. All right. And finally, this is going to be important for the final exam, knowing what motivational interviewing is all about. All right. And again, this will also be sort of a female-male split with regard to who the doctor is. All right. So motivational interviewing is when a doctor and a patient work together to fix the problem. Right. So you have these two sorts of ways a doctor can do this. And I'll give you an example here in a second. Right. If a doctor gives you orders versus if a doctor gives you advice and gives you multiple avenues for success and sort of lets you be a part of the decision-making process. Okay. So when it comes to which is most likely to achieve patient compliance, it's when a doctor sort of works with you and has a conversation with you about what's going to be helpful to you. So let's say a doctor comes in and says, look, you need to lose 50 pounds. A doctor could come in and say, by the next time I see you in 6 months, lose 50 pounds. End of story, right? That's giving you an order. You are less likely to comply with that order, right? If a doctor comes in and says, look, you need to lose some weight. What are some things that you think you can do, as far as your diet and your exercise routine? What kind of time do you have in the day? Do you work too much? Can you wake up a little earlier? Can you come home a little bit later in the afternoon? Like, when can you get to the gym? If you can't go to the gym, are there exercise programs you can do online? Like, tell me what works for your schedule and let's sort of talk it out and make a plan. If that happens, a patient is more likely to comply because the patient all of a sudden has ownership over the plan that he or she is implementing in their life to, lose weight. All right. Now, this doesn't happen as much for a couple reasons. The first reason is that doctors are very busy. So if anybody's ever been to a doctor's office, a doctor, it's usually the nurses, administrators who sort of walk you through all of the, blood pressure, take your temperature, maybe listen to your heart rate, take your weight, all that kind of stuff. The doctor looks at your chart and just says, okay, healthy, not healthy, change these things. I'll see you in 6 months. Like, the doctor visits are usually very quick. It's usually you interacting with a lot of other people. All right. So the doctors usually just give orders very quick because they're ready to go on to the next patient. All right. It takes a while to sit down and have a conversation with someone to say, let's sort of chart something out to sort of get you on a successful plan for losing weight or stopping smoking or eating healthier or whatever it is that you need to do, right? Taking medication. A doctor could say, like, here's a prescription, take this drug once a day, end of story. But they don't really talk you through, like, what are the benefits, what are the risks, like why you should or shouldn't take it. Can you take it every day? Is there a different medicine that you would prefer because this medicine, makes you makes you sick. This other medicine's good. There's a lot of conversation that has to happen, which takes up a lot of time. All right. The other reason that this becomes complicated, or at least interesting, is that there's actually a communication strategies that are different between men and women, right? Men and women communicate differently. You can go into a gender comm class to look at it, but it also, works over into the field of, being a medical doctor. Male doctors are more likely to give orders, right? Men are more direct than women on average, right? It doesn't mean all the time, but on average, right? Women are more likely to sit down and have a conversation and see what works best for everybody in the room. So female doctors are actually more successful in getting their patients to comply with medical recommendations than male doctors, because male doctors just sort of give orders and they go on to the next patient. Female doctors are more likely to sit and to talk and to listen and to sort of create a strategies for success. And you might say, I feel overwhelmed to lose 50 pounds. And they say, well, how about 20 pounds? Do you feel like you can lose 20 pounds? How can you achieve 20 pounds, right? And are more likely to sort of sit there and talk you through the process compared to male doctors, right? So motivational interviewing, patient and doctor, they work together to fix the problem, as opposed to the doctors giving orders. And again, if the end goal of all of health communication is getting people to comply, then the patients or the people you need to comply with regard to hand washing, safe sex practice, coronavirus, mitigating the coronavirus, like the people who you want to engage in these behaviors, they need to be involved in the process. So talk to people with regard to, when can you take your medicine? How much weight do you think you could lose? Okay, you smoke a lot. Like, instead of just saying like you need to quit smoking, it's like, can you cut back from, a pack a day to half a pack a day? Maybe over time, like you can get down to, one cigarette a day, or like one pack a week, or what. Like, start talking with people who actually need to take the advice, because at the end of the day, like, we want a healthier, we want a healthy public, right? We want public health to be functional. We want people to be engaged in healthy behaviors because it helps all of us. But we have to make sure, what communication strategies can we use in order to get there. All right. So, at the end of the day, right, like coronavirus aside, for a second, at the end of the day, like the two things that have always been at the, foremost for cutting down most communicable diseases amongst, the human population is, if you wash your hands, right, and you wear a condom, right, when you engage in sexual activities, like that's going to get rid of the vast majority of communicable health issues, amongst human species, right? Wash your hands frequently, wear a condom when you engage in sexual activities, and a lot of diseases are going to be mitigated, right? Now we're in the world of coronavirus, so now it's also like when you go out in public, like wear a mask, all right, and socially distance, okay? If we can get everybody to sort of do those things in a way that's compliant, right, as opposed to having the experts again tell us what to do, but they sort of work with us to figure out what's a good way to get the majority of people to comply, then we're going to have greater avenues for success, and that's what we want. All right, this is what health communication studies. How can we get the health experts to communicate more effectively so that we have the public engage in healthier behavior? All right, that's health communication. Hope you got something out of it, and I will talk to you next time.